Hey everyone, it's Mary Ann Pizzatola from the New York City Organization of Public Service Retirees. I want to do another short video as requested by transit worker retirees regarding a document that the TWU 100 union put out recently. With that, I also want to make a quick announcement. Finally, you've heard a few videos that we've done and some postings on social media about there being a issue with the contract being renegotiated between Aetna and the New York Presbyterian Hospital and Provider System. So that contract was at risk if it was not codified by the end of March, that by April 1st, you would have lost those providers as in-network, and that would have brought with it a whole bunch of other issues. You would have had to sought prior authorization on your own. If the doctor wouldn't accept the plan for payment, you would have had to pay the doctor. You would have had to hope that Aetna would have reimbursed you. It would have been just a nightmare for many, many people. Finally, yesterday, they did announce that they did finally reach an agreement with Aetna, New York Presbyterian Hospital Network, and so that you are now, your doctor's still in the network of the Aetna plan. So there is no concern there. But make no mistake, this can happen again, and yet we still don't have the full terms of that contract. We don't know how long it's for. Typically, they're about 3 years. So we want to see what's going on with that because you could be facing this problem yet again. But the contract could be 1 year. We just don't know. I'm going to probably guess it might be in the 3-year range because that's the same type of a contract that they made with Memorial Sloan Kettering. But we'll find those terms and we'll update you. So for that, at least now you don't have to worry about that now. So getting back to this, anytime you see Mr. Davis behind me, this is a transit workers video. We are trying to help them with the information. However, this information today is specific to a document that was put out by the union and not a general Aetna thing. So many of you are aware that we've done something called debunking BS or debunking bullshit. It's actually still a page on our website, which this will make it up there. This is a document that was put out by local TWU Local 100. And you'll see we took some liberties with it like we usually do. We put our logo up in the left-hand corner. We said New York City retirees debunking TWU bullshit. Anywhere you see a yellow highlight, it denotes misinformation. So let's go through it. Enhanced medical for Medicare eligible retirees and for you when you retire. So he's telling the retirees and the active workers, we didn't screw you. We didn't give you a crappy managed healthcare plan. We gave you an enhanced plan. So we highlighted the word enhanced because maybe this is enhanced because he gave you some perks, but he took away the one thing that health insurance is supposed to do. I know we joke all the time and we say, healthcare is supposed to provide you with health insurance, health benefits, not perks. It would be tantamount to me selling you a car and giving you a pair of sneakers because if your car never works, we're helping you get to where you need to go by giving you a pair of sneakers. This is exactly what they're doing with Medicare Advantage. So to continue, we are improving coverage significantly. Unlike other unions, we have bucked the downward spiral of care for our Medicare eligible retirees. We successfully demanded that millions of dollars in federal funds go to TWU, enhanced retiree Medicare medical coverage. Oh my God. Really? Seriously? Okay, let's break this down because this is enough in itself. The downward spiral care? What downward spiral was there? Medicare traditional with your CPPO supplement was perfect. It was wonderful. Medicare covered the first 80%. Your CPPO covered the last 20. It didn't cost retirees much of anything. They loved this. Their doctors asked for an ordered a test or a procedure. They got it. There was no pre-authorizations. There's no narrowed networks. This is health insurance at its finest. This is a federal public health benefit. This is what people fought for in 1965. So what we wrote is, you'll see in our little red box, you traded access for bling, and we'll get to the bling below. Medicare Disadvantage is not Medicare. What downward spiral, TWU? I mean, this is kind of crazy. Medicare and the CPPO was the most comprehensive health benefit you had. You took that away for raises. That is criminal. And your young people who ratified the contract listen to you say this doesn't affect you when it does. And because they don't know how healthcare changes, because most people don't, they don't realize that they bought the line that you gave them, which was misleading, and settled for privatized, managed healthcare. And you demanded federal funds? Ha, oh my gosh. You privatized Medicare, a federal public health benefit. The federal funds can be reduced, and you will either pay premium or suffer a loss of benefits. What is this federal funding he's referring to? Well, Medicare basically says, hey, Aetna, I don't want to give Medicare to Marianne, so I'm going to pay you over $1,000 a month to administer Marianne's health care in your form of health insurance. There you go. They just privatized healthcare, and the union did this. This is what I cannot understand. Unions will fight privatization of public schools, of their own jobs, but you're okay to privatize healthcare and put your life in the hands of a private for-profit insurance company, that the only way that they can make money is by delaying or denying you care. And then, of course, restrict you to a narrow network. That's a problem. So let's continue. He then says, our Aetna options 1 and 2 are good with any Medicare registered doctor or hospital in the United States that accepts payment from Aetna. I need to stop right there and not continue because I need to break these down. This is misleading. Now, what this makes you think is that every doctor in America accepts it, and that even continues with the next sentence that says, that includes 99.997% of doctors and hospitals that retirees use today. Okay, with these two sentences, any doctor in America can accept Aetna, but they don't. 99% of doctors in America do accept traditional Medicare. Aetna will not tell you how many doctors in America accepts its plan, because I would probably wage a bet to say it's somewhere around the 70-75% mark, okay? They can accept Aetna. They choose not to accept Aetna because Aetna is a privatized plan that comes with prior authorizations, and it becomes an administrative nightmare for providers' offices. And we've done videos on this. We've even made posts on this where doctors' offices are complaining that they need a full staff of several people, full-time work, just to mitigate these prior authorizations for all of their patients. That's not healthcare. The next sentence that says that includes 99.997% of the doctors and hospitals that retirees use today. Okay. Your entire organization of TWU retirees and employees only has one company providing its health plan, Aetna. Now, they are saying that the doctors you are using today, not the doctors you might need tomorrow, 99.997% of them are in the plan. That's not true either. So there are providers of retirees that we have spoken with that were in the CPPO, that their doctors are not accepting the Aetna Medicare Advantage plan, and they don't have to. So this is misleading in itself. We knew that in our own litigation with New York City retirees because we had over 500 affidavits of retirees saying that their doctors, and even some of their doctors telling us they're not accepting the Aetna plan. It says reimbursements will rise and copays will fall, but the doctors will stay the same. That's not true. Copays will not fall. Copays will increase and doctors will not stay the same. And Aetna says that in their evidence of coverage and in their contract. They have no control over the doctors. They're all independent contractors. And they all sign contracts with the Aetna insurance company. Just because they're there today doesn't mean that they will be there tomorrow. The doctors will not stay the same. And if they're alluding to the fact that you can use out-of-network benefits, you will pay more for that, and the contract says that too. He then says, this is not the city plan. Far from it. There is no comparison. The coverage for our retirees is far superior. Actually, Mr. Davis, it's not. Your network is narrower. You have more prior authorizations in your plan than the city plan. I don't want to get into the habit of comparing garbage to garbage, but the city garbage plan is better than your garbage plan. Your narrow network, you have fewer hospitals in your network. For example, the city of New York contracted with Memorial Sloan Kettering and Hospital for Special Surgery. As of today, for our knowledge, you only entered into a contract as of January, the end of January, with Memorial Sloan Kettering, and it was largely because of these videos and outcry that you were giving them misinformation. And MSK said on the record they were not in your network. You did add them for 3 years. We don't know if they will return, but you have a contract with them for 3 years. You said that the plans that you have had for more than a decade with locked in standards and requirements that coverage and service cannot be diminished. Aetna can't put in hoops to jump when those hoops have not been in there at all these years. We are moving forward, not backward for our retirees and future retirees. Actually, you did move backward. You did a whole 360. You privatized your federal public health benefit. You diminished your health care because now retirees don't have access to that care without a gatekeeper. And if the gatekeeper says no, they don't get that care. That's a pure diminishment. You also diminish the network of which that they are allowed to use. That is another diminishment. And there are hoops to jump through. Your plan is saddled with prior authorization that if the insurance company doesn't approve something that a doctor requires or requests, including even for your medications, because your Part D plan is also under Medicare Advantage, they will not get their drugs, the procedures, or the tests that their doctors are asking for. So now let's talk about the network. The old CPPO plan, like we said, 99.99% of doctors in America accept traditional Medicare. This is accurate. The newly enhanced option 1 also says 1 million. Aetna has a narrow network, and it is not 1 million providers. Remember what we said. The insurance company likes to play with numbers. So if you are a gastroenterologist and an internist, you have 2 specialties. Aetna considers that 2 providers. It's not 2 providers, it's 1. Also, if that same doctor has 2 offices, now Aetna considers that 4 providers. That's not 4. It's still the same belly button. It's the same doctor. 1 doctor has 2 specialties and 4 offices. You need to ask the question. And maybe that's why they never publish their full directory, because they don't want you to know that their eligible medical providers are not really 100. What this really means is eligible is that they're eligible to accept their plan. They don't. And they're not telling you that. You're thinking that you have a same million providers that you had in the CPPO. You do not. So when then they continue to talk about the reimbursement, you get a little bit more money for option 1 than you did in the old CPPO. I would rather get a less of a reimbursement in your situation, and have pure access to my doctors, no prior authorizations, no narrowed networks. I mean, you literally sold off what health insurance is supposed to provide you with. So here's your bling. These are perks to lure you in exchange for pure access to your medical care. Insurance is needed for treatment, not perks. So you giving them vision, hearing aids, silver sneakers, dental, over-the-counter supplies, home meal delivery, transportation to and from your doctors for certain rides for like 12-round trips, that's all bling, right? The union should be providing vision, prescription, and dental like most unions do. As in New York City retirees, most of the unions do provide that. And there is no premium for it. The vision and dental and eyewear, like the eyewear, these hearing aid benefits, $500 every 3 years for hearing aids is only a minor reimbursement. Hearing aids can cost you several thousands of dollars. That's not a benefit. Your vision, this is not also, if you read in the contract, this is not a full comprehensive vision coverage, and neither is the dental. It's limited. So you really aren't getting what you think you're getting. This is misleading. Um, the home meals, we've had people complain about the home meals because the meal delivery is like prepackaged, frozen or dried processed food. They're not healthy. So that's disingenuous. Now, the highlighting down here, we did not do. It came with the document. I said the highlight below is TWUs. This is not the entire truth. And that's because you are comparing that you have zero deductibles for option one and option two, but there's a $150 annual deductible for the city plan. To be quite honest, again, like we said above, in this situation, I believe you are comparing the Medicare Advantage plan. The city did make some changes that you do not have. For example, there is a cost to the city because they did temporarily suspend for 2 years. That can be changed. Most of the prior authorizations, like 70% of the prior authorizations, which you are still have to meet in option one and option two. So the plan for the city would definitely cost the management a little bit more than your plan is. So, but the $150 deductible is really minimal because the deductible for Medicare is like $223. So this is still less than what you would be paying for traditional Medicare, but still this was acceptable for retirees to keep the city supplement and was probably acceptable to your retirees to keep the CPPO. Now, this annual out-of-pocket is still a minimal expense is for out-of-pocket comparison. In your TWU plan, for example, you don't have an out-of-pocket. That means everyone in this plan, if your doctor's out of network and they refuse to accept the Aetna plan for payment, they will forever be paying that doctor if Aetna doesn't reimburse them what the doctor is charging. This is dangerous. So the out of pocket on the 1,500, that's still not bad. Again, I'm not wanting to compare garbage to garbage. So yes, they did put copays on everything, and the reason again is because the plan costs a little bit more because they suspended a large number of those prior authorizations, and our network is a little bit larger than yours. Again, you're being disingenuous. Now, hospitalization did increase at $300 each time, capped at $750. You don't have that. But again, your plan is more restrictive. You pay for benefits. Again, comparing garbage to garbage. Also, you quote a prescription Part D premium of $12.42 a year. This is an issue because most of our unions actually give retirees their drug plan. There is no premium. Again, this is misleading. The drug plan you say has no caps on drugs, 25% co-insurance per drug per month. There's also been negotiations with the drug plan as to co-pays and the amount of months medications that you could receive for your monthly copay. So let's just make this crystal clear. This document is just another way to try to cover for what they did by diminishing your healthcare benefit, privatizing it, putting you in a for-profit managed care plan. Unions should never be privatizing healthcare. Unions should never be putting the lives of their members and retirees into managed health in a for-profit insurance company. This is just another sham document to try to say, but look at all the upsides and the sprinkles and the sparklies, and this is really good for you. No, it's not really good for you because the one thing you need insurance for is to provide you the one thing it's supposed to do: cover medical expenses requested by your physician. This will not do that. It also, in many cases, doesn't cover the physician. So that's the difference, guys. Debunking bullshit. We're proud to keep doing this. It's important that you know the facts and to be able to go back to your union leaders and tell them, this is garbage. Roll this back. And you can roll this back. You just have to have the strength to do it, and you'd get a lot of support behind you. Another episode of Debunking Bullshit.